Well, first off, it does involve what we oftentimes term our reptilian brain, and that helps folks understand that it really is the part of our brain that's not a whole lot different than lower animals. It has to do with survival instincts and the eating, the drinking, the procreating, and so forth. And that is where the disease of addiction works. That's where the dopamine reward system in general operates. And all drugs of addiction, including alcohol, which is the oldest drug, all affect that, and to different extents and to more or less efficiencies in some folks versus others. That's why some folks have the drug of choice as cocaine and others have opiates and so forth. And what we're finding out is not only is that where it operates, but our dopamine reward system to begin with is abnormal, even before the disease occurs. There are some anatomical and neurophysiological differences between, say, my dopamine reward system from birth as opposed to somebody else's who doesn't have this disease. So yeah, every day we're making big headway in learning and understanding some of the neurochemistry, neurophysiology involved with this disease. Well, the dopamine reward system normally is there to continue to have us do the things we need for survival. For instance, when we have a meal and we get nice and full, we get a little burst of dopamine, right? And that tells us, hey, you did the right thing, and that there's that satisfaction. Well, in someone who has the disease and already prone to activating the disease, what happens is to normal stimuli, or I should say to chemicals that we become addicted to, we have an abnormal response. We have an abnormally large response, a larger than normal release of dopamine. So our brains, in essence, determine a new normal for what we perceive as pleasure. It's no longer just the small amounts of dopamine that we got when we had a nice meal, or we took a nice full breath, or we quenched our thirst. It has to do with this new, almost hyper reward that we get, and that's, our brain sees that as the new normal for us. Anything less than that is below a threshold, so to speak. So in other words, you've heard people talk about chasing that initial high, and that's basically what we're doing. And so what happens over time, there's a process called neuroadaptation. And just in sum, what that means is our brain establishes a new normal. We're externally applying all these other chemicals, and the brain's saying, well, I guess I don't need to produce my own chemicals anymore. And so what happens in between the times that we're using those chemicals, our brain doesn't see any satisfaction, any reward, and so we're constantly having to go back. It ends up becoming a survival instinct. At least we see that from the reptilian brain's point of view. It becomes a survival instinct to get that next chemical stimulus, to get whatever dopamine we can get to be released at that point. And so we actually even elicit what's called the fight or flight response to an extent. So it's no wonder that when we look back on this disease, and this is part of the reason why society has a problem with seeing it as a disease, because oftentimes our brain sees no other option but to do things we would not normally do in order to acquire our next drug. And I heard somebody give a talk about this one time, and he talked about, well, people go out and they lie and they steal and they cheat, and then he related it, well, would you do those things if you were starving for your next breath? And you really have to take a minute and think, well, yeah, I guess there are things that I might consider doing that I might not otherwise consider doing. So it becomes a survival instinct. It becomes just a reflex, and the frontal cortex, the higher levels of our brains, can no longer really modulate that response anymore. We don't have control over it anymore. As this field emerges, we're learning more and more about how it's working. But specifically, we are hardwired. Our rewiring is thought to be permanent. So we have to sort of bypass, and the way we do that is using the higher centers of our brain, the frontal cortex. And so we use techniques in the psychology jargon. It's cognitive behavioral therapy and other types of group therapy and one-on-one therapy. But basically, we're trying with the knowledge aspect to retrain our brain to bypass those hard wires, and basically to learn, I guess, in essence, trying to refuse or deny some of what our brain sees as survival instincts. And that's a hard thing to do, as you can imagine. It's not unlike trying to say, okay, I want you to fight that urge to eat the next time you're hungry. So it's a process. And also through the frontal cortex and our higher parts of our brain, we incorporate really the thing that's most successful is what we consider a spiritual program. And the 12-step programs usually have the best success rate there. But in essence, it's a part of retraining, restructuring, rewiring as much as we can, and bypassing some of those abnormal hardwired circuits that have been laid down as a result of our disease.